Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got a 100% on my NPTE, and this led me to co-found SPTwithMe, which is an online NPTE study platform. If you end up enjoying this video and feel it was beneficial, please check out our courses at SPTwithMe.com for our full NPTE studying experience, designed to guide you towards acing your test. Now, onto what you're actually here for, let's talk about complex regional pain syndrome. What is complex regional pain syndrome? A person who has CRPS presents with a disproportionate pain response and excessive inflammation at a region of the body. It's not the whole body, it's just a region. Like the term states, this is a syndrome. It is not a disease. So this means its diagnosis is based on the presence of a cluster of symptoms rather than an actual defined cause, like maybe having a virus. Going off of an article written by Smart et al., the symptoms of CRPS include persistent pain out of proportion from the stimulus, sensory changes, vascular changes, trophic changes. Now, before we go through these, understand that, again, this is a region of the body. So there is an affected side and an unaffected side. So you need to be sure to look at both sides to compare. So sensory changes, hyperesthesia, allodynia, vascular changes. If you look at your left hand versus your right hand or the patient's, you can see and feel differences. For example, color of the skin. One might be a little more flush compared to the other. One might appear a little more blanched compared to the other. Temperature changes. Your patient might complain of, oh man, my affected side, it's very, very cold all the time. Trophic changes. Hair and skin changes. For example, maybe the arm, there is increased growth of hair, or maybe there's decreased growth of hair. As long as there is some difference, it can suggest this. And lastly, the absence of any other condition that might be causing these signs and symptoms. Other conditions that present with similar presentations might include RA, rheumatoid arthritis. It could be something going on with the joint, something going on with the bones, right? Just anything that might present with a similar presentation. We absolutely need to be able to rule out all other potential diagnoses in order to be able to rule in CRPS. So almost think of the diagnosis of CRPS as a last resort. Of course, there may be other signs and symptoms. This can include the patient complaining of joint stiffness, muscle tremors, they might not be able to sleep, they might experience some numbness and tingling. There are two types of CRPS. Both of them, keep in mind, they actually can present the same. However, the difference is the presence or the absence of a nerve injury. So CRPS 1, type 1, this one does not have the presence of associated nerve injury. So if you were to look at the structure of the nerves in the region that's involved, there would be no evidence of trauma, laceration, anything. Nothing that suggests that there is damage to the nerve or a nerve. With CRPS type 2, there is evidence that there is damage to the nerve. Again, some sort of trauma, laceration. Pathophysiology. Unfortunately, CRPS is one of those cases that just doesn't have a well understood one. However, there are theories that surround the concept of central sensitization. Now, central sensitization revolves around two main happenings. Number one, activated glial cells. So the activation causes cytokine release, which then results in nerve inflammation, which is not good. The second one, activated NMDA receptors. When these are activated, this affects the CNS, the central nervous system. It increases pain and decreases the sensitivity to opioids. So there are physiological changes that can occur affecting the patient's experience of pain. And this is very, very important to understand. Going off what I was saying earlier, CRPS is not a mental condition. It is a neurological condition that results in real pain. So take this into consideration. Think about the signs and symptoms that we talked about. How can a mental condition result in physical changes to the body, like temperature differences, swelling, changes in skin color? The answer is that it cannot. It is real pain. Physical therapy treatments for CRPS. Now, for any diagnosis or condition that we come across as physical therapists, we really want to make sure that we identify and treat the source of the problem, right? So the source in this case is central sensitization. Graded motor imagery is a treatment that we as PTs can use to address central sensitization. So let's take a look at this image and let's follow the flow or the order of the treatment. And this flow is suggested by the NOI group. So, number 1, left versus right discrimination. People with CRPS may have an altered ability in distinguishing between left versus right sides. So the concept of this treatment is to look up pictures on Google, on your phone, whatever it is, and ask your patient to identify whether they believe it's a left or a right limb. It takes practice. If you just show a straight leg, it might be a little bit easier, but if you kind of show one that's maybe externally rotated, the foot is dorsiflexed, just something a little bit wacky, it can really throw some people off. The second one, explicit motor imagery. The concept with this is thinking about movement before you actually perform the movement physically. We use the same neurons in our brain when thinking about performing a movement as we do when we actually perform a movement. And this can be difficult and actually elicit pain in those with CRPS. Lastly, we have mirror therapy. So the concept of this, you hide the affected limb behind a mirror in order to trick the brain into thinking that the normal, unaffected limb is the affected limb. So we'll look at an example for the next slide. If you take a look at this image, this displays the idea of mirror therapy. So the person's right leg is behind the mirror. So as suggested by what we just discussed, the affected limb is positioned out of view of the patient, the right limb. Now, when the patient moves their unaffected limb, which is the left leg in this case, the one that's a little bit closer to us, it looks like that their right leg is moving if they look into the mirror. And this is how we trick the brain. I truly hope this video was helpful to you. I really hope it made CRPS more manageable, put concepts together to make more sense. You know, if you come across a patient that has CRPS in the future, maybe you have some ideas in your mind of how to treat them. Again, I instruct the courses on SPTwithMe.com. We have more than 6 hours worth of content that is specifically designed to get you to pass and potentially ace your NPTE just like I did. Please leave comments below, questions, feedback, it's all appreciated. Stay on the lookout for more videos by subscribing. Lastly, here are the references. Take a look at any and all of them. They are all very, very helpful for understanding CRPS. I'll see you soon.